Are you afraid about your pregnancy? Are you scared to conceive your baby? Not to be worried. In this video, I will give you the complete pregnancy guidelines. Pregnancy is one of the most critical and finest moments of woman in her full life. But most of the girls and women do not know nothing about this period. But every girls and women and husbands should know at least something about pregnancy and birth process of a child. In this article, we will give you the general advice and some guidelines which must help you to face this crucial period. If you are really think about pregnancy, then the first thing should come to your head: what have to do before you get pregnant. Think about the lifestyle factors that might affect your ability to get pregnant and have a healthy pregnancy. You are more likely to get pregnant if you are both in good health. If you smoke, get advice about stopping. You can talk to your doctor about eat a balanced diet. Maintain a healthy weight. You should avoid drinking alcohol if you are pregnant or trying to conceive. If you choose to drink, then protect your baby by drinking or more than 1 or 2 units of alcohol once or twice a week, and don't get drunk. Take regular exercise. If you or your partner take any medication, talk to your doctor about whether it will affect your pregnancy. Take 400 micrograms of folic acid a day. You should continue to take this until you are 12 weeks pregnant. If you have a health condition, for example, mental health problems, diabetes, or a family history of any inherited disease, talk to your specialist before you try to get pregnant. Talk to your healthcare professional if you have any concern or need support. All of us waiting for a newborn child. Okay, I think you conceive your baby. What have to do in the initial stages? What have to do 0 to 8 weeks in your pregnancy period? You can take a pregnancy test from the first day that you miss your period. As soon as you know you are pregnant, get in touch with a midwife or your GP to organize your antenatal care. Begin to think about where you want your baby to be born. Some pregnant women start to feel sick or tired or have other minor physical problems for a few weeks. Take 10 micrograms of vitamin D per day, which is in healthy start vitamin supplements or other supplements recommended by your midwife. You should continue to take vitamin D throughout your pregnancy and while you are breastfeeding. What have to do 8 to 12 weeks in your pregnancy period? You will usually attend your first appointment by 10 weeks and your booking appointment by 12 weeks. At the booking appointment, your weight, height, body mass index will be asked about your health and family history as well as about your baby's father family history. This is to find out if you are at risk of certain inherited condition. Your handheld notes and plan of care will be completed. Your midwife will discuss about various tests you will be offered during your pregnancy, one of which is an ultrasound scan to check for abnormalities of your baby. You will be offered information about what to expect during pregnancy and how to have a healthy pregnancy. Ask if you are unsure about anything. You can ask your midwife about your ride at work and the benefits available. You will usually be offered an ultrasound scan between 8 to 14 weeks. This will check the baby's measurement and give an accurate due date. The scan can also detect abnormalities and check if you are crying more than one baby. Your partner can come along to the scan. Make a dental appointment. NHS dental care is free during pregnancy and for you after the birth of your baby. Just 12 weeks after conception, your baby is fully formed. It has all its organs, muscles, limbs and bones, and your sex organs are well developed. Your baby is already moving about, but you cannot feel the movement yet. What have to do between 12 to 16 weeks? Find out about antenatal education. Start to think about how you to feed your baby. Make sure you are wearing a supportive bra. Your breast will be probably increased in size during pregnancy, so you need to make sure you are wearing the right size bra. If you have been feeling sick and tired, you will probably start to feel better around this time. At 14 weeks, your baby heartbeat is strong and can be heard using an ultrasound detector. Your pregnancy may just be beginning to show. This varies a lot from woman to woman. What have to do 16 to 20 weeks? You may start to feel your baby move. Your tummy will begin to get bigger and you will need closer clothes. You may feel a surge of energy. Try to do your pregnancy exercise regularly. Your midwife and doctor should review, discuss and record the result of any screening test, measure your blood pressure and test your urine for protein. Consider an iron supplement if you are anemic. Your baby is now growing quickly, their face becomes much more defined and their hair, eyebrows and eyelashes are beginning to grow. Ask your doctor or midwife to let you hear your baby's heartbeat. In 20 to 25 weeks, your uterus will begin to get bigger more quickly and you will really begin to look pregnant. You may feel hungrier than before. Stick to a sensible balanced diet. Ask your midwife about antenatal education. You will begin to feel your baby more. Get your maternity certificate from your doctor or midwife. If this is your first baby, your baby is now moving around vigorously and responds to touch and sound. If this is your first baby, your midwife or doctor should check the size of your uterus, measure your blood pressure and test your urine or protein. In 34 weeks, your midwife or doctor will give you information about preparing for labor and birth, including how to recognize active labor, ways of coping with pain in labor, and developing your birth plan. They should also review, discuss, and record the result of any screening test from the last appointment. Measure the size of your uterus, measure your blood pressure, and test your urine for protein. Offer your second NTD treatment if your blood type is rhesus negative. Make arrangements for the birth. You can give birth at home, in a midwifery unit, or in hospital. If you have children already, you may want to make childcare arrangements for when you go to in labor. You may want to ask about whether tours of maternity facilities for birth are available. You may feel quite tired. Make sure you get plenty of rest. In 36 weeks, make sure you have all your important telephone numbers in case labor starts. Your doctor should give you information about feeding your baby, caring for your newborn baby, vitamin K, and screening for newborn baby. Sleeping may be increasingly difficult. In 41 weeks, if your pregnancy lasts longer than 41 weeks, you may be induced. Your doctor will explain what this means and what the risks are. Check the size of your uterus, measure your blood pressure, and test your urine or protein. Offer a membrane sweep. Discuss options and choices for induction of labor. Call your hospital or doctor if you have any worries about your baby or about labor and birth. This is the complete pregnancy guidelines for you in your pregnancy period. If you feel to know more, feel free to ask us or visit www.healthandbeauty.com. Press subscribe button to join us with Health and Beauty.